Hi, my name is Maeve Schlichting, and I'm doing a career orientation presentation on occupational therapy. Occupational therapists are responsible for helping patients regain their ability to perform everyday activities, tasks, and work-related activities. These patients may have lost the ability to do this due to mental, physical, developmental, or emotional conditions or disabilities. They also may work with members of the rehab team, like a physical therapist, speech pathologist, psychologist, or social worker. They may also work with specific populations, like children or elderly, or in specific settings, like mental health facilities, nursing homes, or hospitals. Occupational therapists will perform many different tasks during their regular workday. The first task that they may be asked to perform is to review patients' medical histories and assess their conditions and needs. Secondly, they will have to evaluate the patient's ability to do certain tasks. They will have to confer with other members of the patient's care team, such as doctors, their families, nurses, therapists, or social workers. Then they will develop a treatment plan for the patient with specific goals and tasks to help them reach their goals. They will have to demonstrate exercises that can help the patients perform their everyday tasks better and help to relieve pain. They will also have to guide the patients to perform these tasks to meet their goals. Next, they will evaluate the patient's home or workplace and identify potential areas for improvement based on the patient's needs and goals. They will also have to recommend and teach patients how to use adaptive equipment that will help them with daily living, like wheelchairs, eating aids, hearing aids. As their treatment plan progresses, they will also have to assess their patient's progress towards their goals and prepare reports for healthcare and insurance. Occupational therapists make between $54,000 and $120,000 a year. This can vary based on location, experience, and the industry they're working in. They have an excellent job outlook. It is supposed to grow 24% from 2016 to 2026. This is higher than the 7% growth projected for all jobs in the same period. OTs with additional certifications or specialized knowledge in specific areas will have better job prospects. The excellent job projection is due to the baby boomer generation and their need to stay active as they age, as well as patients seeking non-invasive treatments for different conditions and illnesses. To become an occupational therapist, one must get their bachelor's degree. Some recommended majors for a bachelor's degree would be biology, psychology, or exercise physiology. Once you obtain a bachelor's degree, you must obtain your master's degree in occupational therapy. Once this is completed, you must sit for the board's exam to get your professional license. Once you pass this exam, you may begin working as an occupational therapist. The admissions criteria to qualify for a master's program in occupational therapy is a minimum GPA of 3.2. You must have all of the required courses that the program requires, which may include statistics, social science, abnormal psychology, developmental psychology, and human anatomy and human physiology. You must also take the GRE exam with a quantitative score of 300 and a writing score of 4. You will also be required to submit a resume and letters of recommendation. Some programs also require observation hours. Some other things to take into consideration when considering occupational therapy as a career is your volunteer hours, as a lot of programs also require that. Since the WU Exercise Physiology program requires 100 volunteer hours before you graduate, most of you will be fine. Additionally, a lot of programs require 40 direct hours of shadowing an OT before you can be admitted to their program. Additionally, the cost of programs is very important, as they are very expensive and 2 to 3 years long. Also, a master's degree in occupational therapy is required to practice, but a doctor's of occupational therapy is required if you want to go into administration. The last thing to consider when going into occupational therapy is the skills and competencies that are required of this job. Some important skills that one must have is communication skills, as you will be communicating verbally and in writing. You must be able to communicate to your patients and have them listen to you to meet their needs. Compassion and patience is of the utmost importance in this profession because you will need to help patients set realistic and achievable goals without discouraging them. Lastly, critical thinking is important to make educated decisions about what is best for the patient. I hope you have a great 4 years at WU and study hard.